I'm Benoit Peyronnet, a urologist from France. I work at the University of Rennes, and at the SCO, I'm in charge of functional urology and reconstructive urology. So this year, there are several things that make EAU special and exciting for me. First, we're going to Madrid, which is a fantastic city, very dynamic. So for all the social and networking, it will be, I'm sure, fantastic. Especially in March, starts to be a little warm, etc. So that will be cool. And of course, the program is, we tried our best to make a very exciting and engaging program for everybody to see. And for me personally, it's the first year as a member of the organizing committee. So again, I tried to bring some fresh ideas and hope people will like it. So we tried to put focus on several aspects, like a broad aspect of functional urology. Will basically talk about everything: BPH, neurourology, female LUTs, chronic pain, pelvic organ prolapse. We included it all. We did, I think, a very interesting session, plenary session on prosthetic surgery, which is of particular importance right now because we're facing the mesh controversy in many areas in Europe. So we need some guidance here on how to deal with that, and this plenary session will be, I think, perfect for that. We also included some surgical session on robotic, benign and reconstructive surgery, which is growing, and we want to make space for that at the EAU Congress, of course. And then we'll have some, I cannot reveal all the secrets, but we'll have a very important randomized trial that will be presented for the first time in the field of overactive bladder at the EAU. One of the game changers probably, so a lot to look into for those interested in functional urology. In terms of education, I think we try to make it as educational as possible, of course. And I think if you look at the program, you'll find a lot of interesting pieces. We try to cover a broad spectrum with like diagnosis, treatment, some stuff very surgical. And so I think for a trainee or for someone even with some experience who wants continual medical education, they will find every aspect of functional urology there. And so we hope they find it educational as well. To tell my experience, the first time I went to the EAU, I was amazed to meet people that for me are legends of our field in real, and you can interact with them. And so those big names that you've seen in the papers, etc., they will be there, and make sure that you go to them at the end of the session, you ask them direct questions. This is something you cannot do anywhere else than going at a conference like EAU. From the comfort of your home, you cannot discuss with those leaders, and you will have the opportunity to do so at the EAU. So that's one particular trick that I consider very important for you to enjoy.